Did you say that you thought it was bad to be employed, or is that the right wording used?
Well, I may have said that, but I'm glad you asked because employment in and of itself isn't bad, right?
Okay.
I mean, being independent isn't for everybody. Being employed isn't for everybody either. You know, I think, however, that the way the systems, and by when I say systems, I mean the hospital systems and the third party payer relationship with the systems is not good for medicine. It's not good for patients. Everybody has their story about, they don't know who their physician is anymore, or, your physician has left. So basically you just get assigned another physician. So patients are kind of herded inside these systems. So there's an effect on that. We know, and I know the cost of healthcare is unsustainable the way that it is now.
Mm.
A lot of different reasons, which is why independent medicine is a good antidote to that. So I don't mean that being employed is bad. In medicine, it's a little bit different than being employed in a lot of other businesses. A lot of them, we all depend on employees, and I don't think my staff thinks that being employed is bad, right?
Right.
But as a physician and as a patient, overall, I think it's much better when the doctor and the patient are in control of a lot of decisions, which within the health system, that control is taken away.
We've had many guests on, particularly people that shifted out of the big healthcare system into like cash pay models or like direct care. I've heard many of them say that they felt like they were having a hard time providing the best possible care for their patients in the
Right.
system. And I think that ties into what you're saying is there's a lot of conflicts. It's like if you're in primary care and you have 7,000 patients, it's impossible for a human, it's one person, to manage that and take good care of them. And then on top of that, they're like, there's pressure to increase it, even though you.
Well, right. So, I mean, I think that is what I see as at the very, very bottom of the whole issue is that there was always going to be a conflict between the agenda of the physician as far as medical and the system as a business. I mean, it is very difficult to reconcile those two things
Hmm.
unless the person in charge of the business is the one providing the care.
Yep.
Because I feel very confident that I make decisions that are medical that aren't particularly financially the best for me, right?
Hmm.
But I have a fiduciary responsibility to my patients to provide the best possible care.
Hmm.
So I can juggle those things because they're under my control. A physician who's employed, and again, I'm not bashing being employed. I just think that a lot of the issues that are buzzwords now, like burnout and all these other things, are a reflection of this very core discord that there is between what the agenda of the doctor is and what the agenda of the system is. Not that they're not interested in providing care, good care. It's just that when it comes down to maximizing the business side, that always wins over because that is the business that they are in. Whereas the doctor can juggle that and have control over that. And I can make decisions for an individual patient at a particular time, which is not mandated by a little box I check on Epic, which is the most
Yep.
common electronic record or cerner. It doesn't matter. My point is that I am able to make decisions not necessarily that fit an algorithm which is designed for billing purposes.
Hmm. Yeah. And ultimately act more in the interest of the patient. I've thought about that a lot with young people, especially a lot of people coming out of training. I don't know the stats on this either, but I would assume it's even more pronounced that they're going to hospital employment type setup than the established ones. And I'm just curious. I wonder if they know that what they're getting into. Maybe not. I mean, you can't know what you're getting into
Right.
when you
No,
have
I
no
understand what you're
experience.
saying. And I think that's one of the things that indie docs or the organization that I'm leading now is one of the things that we're very interested in doing is exposing medical students, residents, fellows in training, physicians in training at every level, regardless of specialty, to independent practice. Because I think what you're alluding to is that, if you don't know that you have this option, then you don't know you have this option. So you assume you have to do the others.
Mm.
So we all train in a system because that's just the way you get taught. Except that when I was going through training, there were actually rotations through private practice.
Yeah.
But if those don't exist, and there's some specialties that still do that, but many don't, then you just don't see that as an option. Or what you see is this big system. And as an individual, you think, how can I duplicate that? How is it that I can provide all the financial things and all the insurance, pre-certification? I mean, you see this very, very large organization, which it's hard to imagine how you would duplicate that if you were in charge of that. Well, you don't have to be that big.
Well,
It can be just you and do it on a smaller scale if you're taught how to do it.
and there's a lot of baggage that comes along with being big. It's very difficult to change. First of all, there's all this red tape and insurance and billing and stagnant and, old ways of doing things. And lots of old guys being like, oh, this is the way we do it just because this is the way we've always done it. Don't ask questions. That kind of thing is rampant in big organizations.
Yeah, and again, that was the reason that I left after 10 years. I had an extraordinarily busy practice. I'm very grateful for the opportunity that I was given when I first came out of training by the chairman that hired me. It was great until it wasn't great. And the reason that I decided to leave was I had things that I thought I needed to do to promote my practice, right? So priorities 1, 2, 3, and 4, whatever those were at the time. Those priorities within the department's priorities were maybe, 9, 17, and 47, and 93 or something.
Oh, God.
And then if you put the department's priorities inside of the system's priorities, it became very clear to me that those things that I thought were important were never going to happen.
Mhm.
They just were never going to happen, right? So that's when I thought, I'm going to do this on my own. And again, not that it's easy, it's work, all that kind of stuff. But at least I felt, and it's turned out to be true, that you at least have control, you have autonomy, which is another thing that's been recognized as key to enjoying what you do, regardless of what your profession is. Being able to make decisions, good and bad, right? So it's not like it's all roses by any means, but at least you feel you get, well, gosh, I made a mistake, I can fix that tomorrow, as opposed to I made a mistake and now I have to wait on a committee to decide, and I mean, it just gets bigger and bigger and bigger. And that individual ends up invariably feeling like they don't have control.